Since earliest history, humans have communicated through stories told in language and pictures. As a small child, I loved stories, and Christmas time reminds us of the power of one of the greatest stories told through generations. Later, as a medical student, I still hear my teachers impressing the importance of listening to the histories that patients tell us to enable us to make diagnoses as doctors. I often get asked why I do this role, what motivates me. So to answer this, I want to tell a story, the story of 3 generations of a family registered with my practice. Although done with their consent, names and details have been amended to protect their identity. But all clinicians, those involved in caring for patients, and many patients and carers themselves will recognise these descriptions. Muriel was born in 1935 to parents who had a family history of mental illness. Her early life was impacted by domestic violence and turmoil at home and other difficulties at school, and as a teenager she had her first episode of mental illness, aged 17 years. After a number of admissions, she became addicted to prescription drugs and alcohol. She had a turbulent young adult life with a number of partners. Her lifestyle choices, diet, smoking, alcohol, resulted in the development of a number of long-term conditions and by the age of 70 plus to multiple comorbidities, memory problems and multiple interventions from social care, mental health services and health services. Her daughter, born into chaotic circumstances, developed depression aged 7 years, early drug and alcohol dependency, epilepsy, and after a difficult adulthood has herself a range of long-term conditions and ongoing mental health problems in early middle age. In turn, her son Joshua, again born into domestic violence, was adopted soon after birth, but displayed behavioural problems aged 2, followed by school truancy and antisocial behaviour, drug abuse in his early teens, and prison sentences as a young man. He currently abuses drugs, smokes 40 cigarettes a day and drinks large quantities of alcohol. A story of 3 generations of a family, our most vulnerable families, but replicated to greater or lesser degree across Camden, all with predictably poor outcomes, and who, when the cost of their care is added together over the last year, amounted to approximately £1 million of taxpayers' money. Why do I tell this story? Because it tells us so much about why and what we have to transform in our system. The integration of care is not a revolutionary idea. Herodotus in the 5th century BC gives examples across the ancient world of integrated models of care. Renaissance Italy delivers some of the best examples of integrated care. And caring for patients in a compassionate way to meet their needs must surely be a basic measure of any civilised society. Integrated care is not just about looking after elderly people. Most patients with mental health problems will have had their first episode of care by the age of 25 years. Only 4% of patients with known mental health problems as young adults transition into planned adult services. The vast majority represent with multiple, often entrenched problems much later in life. The services we have in place often do not meet the needs of particularly young, vulnerable adults. For children with complex needs and their parents, for those with long-term conditions, and for those with multiple complex problems, navigating a complicated system where a plethora of providers across health, social care and the voluntary sector provide individually high-quality services, but which are not joined up around the patient, often results in patients experiencing fragmented, unplanned and poorly coordinated services, reflected in both worse outcomes for patients and costly duplication to the system. Camden CCG has set out to try and change our system locally. We are trying to focus what and how our services are delivered around the outcomes different groups of patients tell us are important to them, and, along with clinical outcomes, to measure our providers against delivery of these outcomes. Outcomes important to patients. Feeling care is joined up, planned, coordinated, empowering them to stay at home or school, putting their needs first, drives integration of services across organisational boundaries, requiring different providers of care to align around delivery of these outcomes. For all long-term conditions in the widest context, the goals are firstly the prevention of the disease if possible, secondly the earlier identification of disease to avoid long-term complications, and thirdly good disease management, but that also supports self-management. The majority of this care could and should be delivered in the community with support from specialists. Local providers across health and social care, along with patients, have worked with us to co-produce models which are now implemented, to pilot new ways of working, to capture the data from services to understand what works and what needs rethinking, and crucially to form and build the relationships that are at the heart of a new way of working. The CCG programmes around complex care, mental health and long-term condition and prevention have already achieved significant measured improvements in care, increased prevalence of disease, case management through multidisciplinary teams, a range of cross-cutting services, pain management, IAP psychological services, memory services, with increased numbers of children whose complex needs can be met in borough, and improvements in rates of cancer screening. Primary care has a pivotal role in all our programmes with its unique understanding of both population needs and individuals' outcomes and goals, and its role as a system integrator. Encouraging the sharing of data, peer review, support and education to primary care by specialists and clinical leads, and investment in some underpinning enablers such as IT are essential to the success of delivering our CCG objectives. The Orion system, procured, which integrates all local health and social care systems across Camden, and the associated data sharing agreements across organisations, was finally launched last week and will be an important step forward in 2014. Our focus next year as a CCG will be to take the models collectively developed and implemented and embed them to deliver the outcomes and value for patients. We will continue to work with all our stakeholders to ensure the models are understood, the workforce has ownership of them, and that they are upscaled to benefit increasingly large swathes of our population. We will continue to look at new and more effective ways for patients to access our services through better coordinated and planned services, the use of modern technology to access advice and guidance, and ensure that patients are seen in the right place to meet their needs. All our work will be underpinned by the capture of measurable outcomes data, which will drive improvements in quality, identify unmet need, and inform the commissioning or decommissioning of services. Our links to the local authority, particularly the Health and Wellbeing Board, will drive greater clarity on improving the wider determinants of health and linking health with social care. And we look forward to developing the plans through the Health and Wellbeing Board for the use of the integrated care funds to improve our Camden residents' outcomes. Next year sees a new milestone for the CCG, as in May elections to the governing body will be taking place. I hope that many of you will share the passion and drive of our existing elected members to improve services and outcomes for our patients, and that you will see the elections as an opportunity to come forward and join us in providing the kind of clinical leadership that has allowed our CCG to flourish and deliver. We will be arranging opportunities early in the new year for those interested to find out more about the roles, and I look forward to meeting you all. Finally, I thank everyone for their hard work and support over the last year and wish you all a happy and peaceful Christmas and a very successful new year.